have a month-long exchange.
Welcome to another episode of the Edmonds Moms Room podcast. We are so honored and delighted to have Miss Jessica Psenski with us today. What is your title?
So I'm a licensed mental health counselor associate. So that means I'm a mental health counselor. I practice in Kirkland, and I mostly work with moms. So
awesome.
I'm really excited to be here. Thanks for having me.
Cool. Thank you for being here. So this is the Moms Room podcast.
Yes.
So I am so excited to dive into kind of what you do for moms, how you help them, and all that fun stuff, and how they could benefit, even just from hearing this a little bit. Do you work with moms across the life cycle? I'm all congested today with words.
It's okay. Yes, I do. I will say kind of the bulk of the moms that I see tend to be really new moms, but sometimes I'll see moms who are becoming moms again, having second and third children, and any moms who have more than one child can attest to the fact that the dynamic really changes in your family every time you add a new little life. So we talk a lot about that. One of my favorite things to do actually is to see expecting parents, moms and dads, and partners. I love to see couples even prior to delivering baby. It's just a fun way to kind of help them navigate some of the challenges that might lie ahead. And of course, most of my clients who I see during pregnancy find they're ready to come back after baby comes because they figure out, all those things Jessica said might happen are happening, and now we need some extra support. Cool. But I see moms who have kids all the way through elementary school, some even high school and college. But I really do focus on kind of the perinatal period, which would refer to, about the year before and after having a child. That's where a lot of my specialized training is in. So that's kind of the majority of my practice.
Nice. I want to dive more into that, of course.
Totally.
But where'd your passion come from?
Great question. So when I was pregnant with my daughter, who is now 4, I had applied to a program at Northwest University over in Kirkland for my master's in counseling psychology, and they were about to accept me. I had an interview, and then right around the time I got my acceptance letter, I found out I was pregnant. And I just decided at that point I wasn't ready to tackle graduate school and new motherhood all at the same time, and I'm glad that I made that call. So I decided to defer enrollment for at least a year, and I got to stay home with my daughter. And during that time, I was really lucky to have so much community support. I went to, a mom's group over at Evergreen Hospital, parent-baby classes, and that was such a great community for me. I kind of found my mom tribe at that point. And what I really started seeing was so many moms just really struggling with the transition, myself included, and I had a ton of support from my husband, from my mother, who happens to be retired, so I was super lucky. I had a lot of extra help, and from my friends. But I was noticing some moms in my group and in my community were having such a hard time, whether they were having their first or second child. There were so many aspects of being a new mom that were just a struggle, from breastfeeding to adjusting to that new mom identity and who am I now that I'm a mother? Am I still all the things I was before? Questions like that coming up. I met a lot of moms who were dealing with postpartum depression and anxiety. And so when, fast forward a few months to the time I decided I was ready to go to school, my daughter was 13 months old when I started. That was really my focus. I was very much ready to get that degree and then go into practice serving moms. So that was kind of the lens I worked from even in my school and internship years. I just wanted to support moms, having been in that season of life so recently. Yeah.
Fantastic. That's so cool. And of course, I think every mom needs support.
Absolutely.
Whether you have a diagnosis or not.
Absolutely.
And so I think having someone to talk to outside of the family, an unbiased reflection, someone who can give you tools is so essential.
Yeah. And I love what you said, diagnosis or not. I would say I have several clients who do have a diagnosis of a PMAD, which stands for a perinatal mood and anxiety disorder. So that would include postpartum depression and anxiety. But a lot don't, actually. A lot don't meet the criteria for diagnosis, but still need a ton of support. We all do when we have kids. So that's something to mention. A lot of moms are hesitant, do I really need to see a therapist? Do I really need this? yes, it can be beneficial no matter, kind of where you fall on the mental health spectrum. Like, if you feel like you need support, it's because you need support, no matter what.
That's cool.
Yeah.
So do people reach out to you because they need support, or is someone referring them to you?
A little bit of both. I have some really wonderful colleagues and, kind of people in the community who refer to me. One of them, I've gotten some great referrals from local hospitals. Cool. Sometimes OBGYNs are really helpful. They recognize that some of their patients might be struggling and send them my way. Some colleagues in my office just kind of know what I do.
Yeah.
I get to do a lot of networking and coffee dates with local therapists, and some of the specialized training I've done in perinatal mental health has given me a lot of great connections. So a lot of it is referral based. I've gotten referrals from you. But yes, sometimes, people kind of need a little bit of direction, especially new moms when your world already feels a little bit upside down to begin with.
Right.
A lot of moms are like, I don't even know where to start finding a therapist. So it's great when there are people in the community who are already working with moms who can kind of point them in that direction. And that's where most of my clients have come from, is other people who say, oh, you are looking for some help? Great. I know Jessica. Yeah. Give her a call, send her an email. And that's how I connect with most of my clients.
That's cool.
Yeah.
I'm a little biased. Like, I think every mom needs pelvic floor therapy, no matter what. I think every person needs to learn how to use their pelvic floor. But I also think that, like, everyone needs someone to talk to and a counselor.
Yeah.
And so it's almost like, I love hearing that you get, like, doctors reaching out and things. Because it would be so cool, like, if you leave the hospital and it's like, here's, like, these are the things that you need to have. Like, don't just go to your 6-week checkup, but, like, so you can survive this life and maybe not just survive, right? But, like, feel good.
Totally.
Have this support. And so that's really, it's cool to hear that people are hearing from it that way, because I think, I don't know, it's not offered, Right. At my postpartum checkup, I was given I had maybe, I don't know, undiagnosed, but you don't feel normal no matter what.
Right.
Or whatever your normal is, because your hormones and everything else, all the changes.
Yeah.
But I didn't fit the test, my doctor gave me a test, and it's like, I don't fit postpartum depression, on paper anyways.
Right.
But it's like that could have been the perfect point to intervene. Well, like, why don't you just go talk to someone anyways?
Yeah.
Like, and just learn some tools.
Yeah.
Figure out how to change your identity in your life,
Yeah.
So I commend what you do for that.
Thank you.
My next question, and what I'm interested in many things, and I want to talk about a few for sure if you're willing to discuss with us. But I love the prenatal aspect, because that's not something I really put thought to.
Yeah.
So this is maybe even preconception to prenatal.
Yeah, and another, aspect of my practice that is not, I would say, kind of my most, like, not the bread and butter of what I do, but I do see clients who are dealing with infertility. I see clients who are trying to conceive. So I really consider myself to be someone who can support couples and women throughout this whole journey to motherhood, along all the bumps and bruises and highs and lows along the way. So yes, often I'll find we are working through infertility or working through conception, and then when a pregnancy is achieved, we start to talk about, okay, so here's some complexity here. Women who have dealt with infertility are at higher risk for postpartum mental health struggles. So it's good to be preparing those moms. But moms who haven't even, it's so great to be able to sit down, and I love seeing couples and families advocating for themselves in that way, like recognizing this might be a need. I'm going to, kind of tackle this head on before it becomes something I'm struggling with after I have my baby. So yeah, I do some prenatal work, and it's really fun because it is an opportunity, one, to support moms in pregnancy. Your body is going through so much, and there's just a lot to contend with in pregnancy. There's a lot of stigma around pregnancy for working women sometimes. And so it's really nice for them to have a space to process, like, okay, this pregnancy, some of them are dealing with, morning sickness and a lot of pain and discomfort. I know you see a lot of that. Yeah. And so it's a great time to be able to kind of catch those moms and give them support, so they're feeling empowered going into motherhood rather than feeling like they're playing catch up when baby comes, like they're being proactive rather than reactive. And I really love seeing that, and I really love working with those couples and those individuals who choose to do that. It's great.
I'm sure that helps the stability postpartum.
Yeah.
You know, just like mental stability, kind of.
Yeah, and I would love to say that it totally prevents any, struggles. It doesn't.
No.
Those may come either way, but what it can do is give that mom a touchstone to come back to, like, I have Jessica, I have a plan in place. A lot of my prenatal clients have actually had children before and dealt with postpartum depression or dealt with a really difficult transition. Maybe they had, some tearing or some really difficult physical complications after giving birth, and there's been some trauma for them, and they're feeling really fearful and really, nervous about having another child, and is this going to happen to me again? So a lot of the work we'll do is make a plan. What symptoms are you going to look for? Who's your support? How are you going to get a little bit of sleep? Like at least one REM cycle a night, some of these things that honestly feel kind of impossible when you have a new baby, but are so important for maintaining your mental health. So we talk about that. Like, what are you going to do? You have my number. When's your first appointment going to be? Just like you talked about, like a lot of my moms will kind of go on their therapy maternity leave. Okay, it's about time for baby to come. I'll see you when? And we set a date. Like, I'll see you when baby's 4 weeks old, and babies are always welcome up to about 12 months in my office, I say. Because that's when they get a little mobile and it gets harder for mom to concentrate. But I love having little ones in the office. I have some toys and things like that, and make it possible for mom to get there. I like to remove those barriers. But really that's part of that work, is making sure mom feels prepared for what's to come after baby, even if it's not an easy transition.
Right.
Yeah.
That's fantastic.
Yeah.
That's so cool.
Thanks.
Fun. Do you want to say anything else on prenatal stuff? Because I want to explore so much with you.
No, nothing's coming to mind on prenatal stuff. Yeah, just preparation. I will say one of the things that has been so enriching for me is to work with couples who are expecting. It really does give them a sense of control, and like, we have this in hand, and if turns out we don't, after this baby arrives, like, we have a support system to go back to and address some of the stuff that comes up. Because often, when you're not sleeping and you're stressed and you're tired and you're overwhelmed, any issues that were present in a relationship before are suddenly going to be like 100 times magnified, and it's going to feel really intense. And a lot of couples find themselves, I know I did, right, really surprised by that. Like, oh, wow, sometimes I don't like you. There's a book out there, I wish I could remember the author off the top of my head, but it's called How Not to Hate Your Husband After Kids. And we all laugh about that, but really there's some reality to that we struggle with adjusting in relationships to having children. Who's going to do which tasks, which roles is everyone going to be responsible for? How are we going to get all of our stuff done? New babies take on average about 10 hours of time a day. And so when you take all the stuff we're already doing before baby comes and try to subtract 10 hours, it's kind of like, oh my gosh. So couples especially really need to hear that and kind of get some education and ideas for themselves around how are we as a couple going to navigate this, and how can we do it well? Yeah.
Cool. I need that book.
Yeah.
It's like so many of my conversations with clients too. That's why I'm like,
there's a lot of frustration that comes up.
But it's so not funny because it's reality, right?
It's totally reality. Yeah.
So that's great. You've just blown my mind a little bit. Like, I don't know why I didn't think of supporting prenatally.
Yeah.
So now all my clients are going to get that referral.
Yeah. Not too different from PT, right? There's so many ways to prepare the physical body for birth and postpartum. This, same goes for the mind and the heart and the relationship.
Yeah. Completely.
Yeah.
Cool. Okay, I want to dive a little bit postpartum.
Let's go for it.
So that's its own entity.
Oh, yeah.
So we have clients that struggle with tearing, struggle with pain, struggle with maybe just feeling different, like even if it's not, necessarily a diagnosis, right? Just feeling different, less energy, all that stuff, and then sex life.
Yeah.
So that has a big impact. Women have less estrogen biologically, and those levels don't necessarily return to normal if you're breastfeeding,
right,
and all that stuff. So I guess, how do you support the postpartum period? Outside, I don't really want to focus on the diagnosis per se.
Sure.
Just so, because if we did that, we can say postpartum depression, postpartum anxiety, postpartum mood disorder, but I feel like that like cuts out a whole bunch of people who don't identify with any of that. So that's why I'm hoping to leave it open, if that's okay.
Let's do it. And really, like I said, so many of my clients don't present with symptoms that would be aligned with a diagnosis. So, but there is this undeniable reality of like everything has changed. And something I didn't mention before is a lot of my training is in sex and intimacy therapy. So I do, and it's funny when I can always tell if the person I'm talking to has had children or knows about children or knows about, delivery, postpartum physical impacts, right? Because when it's someone who hasn't, they'll be like, oh, that's an interesting combination. And when it's someone who has, they're like, oh, that makes a lot of sense. Those, oh, yeah, perinatal work and sex work really have a lot in common. And they absolutely do in the therapy world. So, I love everything you just said because it's also true. Like everybody experiences this feeling of different and not the same and maybe not right. And we start to feel really just out of home in our bodies, like we're not at home in our bodies, and that can be a really disorienting feeling for women. So one of the first things we talk about postpartum is just I give moms space. Like so often we just want to be heard. We just need to tell somebody who understands and who will listen what's going on. You have partners, you have friends, and we can talk to those, to a certain extent, but it's nice to be able to just put it all out there and not have to worry that the person you're sitting with is going to judge what you have to say or feel weird about it or uncomfortable about it. So that's the first thing is I just want to give mom a minute or two or 60, the whole session if she needs it, to just, how's it going? How are you doing? Really, how are you doing? And letting her be honest and letting her be open about that. I do a lot of education, honestly. You mentioned estrogen and hormones. I have a little very basic bare bones graph in my office that I show new moms, and it shows all the different hormones that are present within pregnancy and how once your baby is delivered, I realize I'm using my hands to talk right now. Nobody can see me. So picture a big, huge slope and then picture your hormones just falling right off of it. And that's really what happens at delivery. And a lot of women understand to a certain extent, like, oh, yeah, my hormones, but not really what is happening and what a big change it has been going from pregnancy to postpartum, literally overnight. And so it feels like a big crash. So we talk about the baby blues, what's normal and what might not be normal. So, letting them know what you're feeling. If you are 3 weeks postpartum and you are crying at the drop of a hat, that's okay. It's okay to feel that way. It's normal to feel that way. A lot of validating of the experience. Like a lot of these things are felt by pretty much every new mom. And I love being able to tell a new mom that and watch the relief on her face. Like, oh, okay. I'm not alone in this. This is okay. This is going to get better. This is, so we talk a lot about that, like kind of what to expect and why you're feeling the way that you feel. A lot of the stuff is really also pointing women toward community resources. One of the biggest things, the soapbox I will always get on is community, community, community. Like what's here in Edmonds. I live over on the east side. I live in Bothell and practice in Kirkland. So I'm pretty well versed in what's over there. But, letting women know, like, what is a place you can go? Where can you find support? Is it a support group? Is it a PEPS group? Is it just a mom's group? Right. Is it an exercise class like stroller stride, something like that? Where are the places you can go to feel like you're supported and you're not alone and you have your start to build your tribe a little bit. And for things like, I hear all the time from women, sex is terrible. I don't know what to do. It hurts. I'm uncomfortable. It doesn't feel right. And usually the first thing I do is refer them to someone like you, just to make sure everything is the way that it should be. 6 weeks is such an arbitrary number as far as checking in to see how a woman is recovering after delivery. And I always let women know that too, that, you might not feel ready for sex after 6 weeks, but you've got this partner over there like, so 6 weeks, huh? Are you ready? And you might not be. Some women are ready to, return to sexual intercourse and normal sexual activity after 4 weeks. Some not till 12 or more. So, letting each woman know that like your your experience and your readiness is completely dependent on you and your healing and how you're feeling about that. That's something we normalize a lot. And if someone does have some actual kind of physical issues happening, and that's really common in my practice, I see a lot of women who are experiencing that. We talk a little bit about how we can return to intimacy with partners if she's desiring that, and most women are, but how do we make it so that it's comfortable for you? How do we make it feel safe for you so that you're not, concerned about feeling pain? Because if something causes pain, you're not going to want to do it, and then desire kind of tanks a little bit, right? Besides the hormones, it's also this sense of this act could be uncomfortable. Yeah. I don't know if I want to do it, right, which, hey, makes sense, right? So that's something we talk about too, is what are some other ways that a couple can engage in intimacy that don't necessarily include sexual intercourse or, aren't necessarily the same as they used to be. One of the things that my favorite analogy is think about before you had a baby going to the grocery store and how easy it all was. You parked, you got out, maybe you grabbed your purse, you walked in, you grabbed your stuff, you paid, and you left. Now grocery shopping is a little more complicated. Does baby need a fresh diaper before we leave the house? Get baby buckled, put baby in the car, drive to the store, get baby out. Maybe you put baby in a carrier or a stroller, or you carry them in and set them in the cart in their car seat. I mean, there's just a million more things you have to think about that weren't necessary before you had this child. Same goes for sex. Sex maybe used to just flow really easily between a couple. Maybe it didn't, and we can talk about that too. But a lot of times we expect to just have this baby, 6 weeks passes, and we're going to go back to business as usual. Yeah. And it is so not that way. Everything is different. Right. And that's okay. It doesn't mean everything is bad. It just means everything might have to shift a little bit, or some things might shift a little bit. So that's something we encourage and we talk about in session 2.
Yeah. I think that's so needed. One thing that we're talking a little bit about the physical part of it, but I think there's also this, and I experienced this myself after I had my first child, almost that, I'm a mom, I can't have sex. Yeah. It was this whole weird identity shift of, is it okay for me to, want sex or, be involved in sex, but I'm, a parent? Mm-hmm. And there was just something that was, they felt completely opposite.
Yes.
And it was weird, you know, and being oh no, I can still want sex. I can still enjoy sex.
Yes.
It had nothing to do with the physical body per se, but more of my role and identity in life. Yeah. So that's an interesting,
that's such a good point,
component of it.
Yeah. And that is another component of it, of this, especially there are moms who, baby might still be sleeping in your room or in your bed. I've had couples so we co-sleep, how do we have sex? And we troubleshoot that a little bit. But yes, that's such a huge identity shift. I'm a mom now. Moms don't have sex. Well, obviously they do, right? Yeah. Most of the time, in most cases. But, getting to talk a little bit about what's it felt like for you? Some of it can be physical, right? My body doesn't feel like a sexual being anymore. How do I reclaim that? And that opens up the door to all kinds of discussions about identity, for moms who were working and then stopped working, or moms who went back to work but don't want to be at work anymore. Right. All of those different levels of experience. What does this look like for me now? And who am I now? And so we can explore that. And sexuality is a big piece of that. Yeah. Sometimes I'll invite partners into the room, because if you don't see yourself sexually, your partner certainly still does most of the time. Yeah. And if they don't, we talk about that too. And how can this couple come together? How can the woman be supported? How can the partner be supported so that they're feeling like they're getting what they need? And maybe there does need to be a process of kind of sexual rediscovery of who am I now? What can I appreciate about this body now that I've given birth? Yeah. Sometimes that can be really empowering for women, so we work on that a little bit. And sometimes that can bring a whole new lens of sexuality. Does that make sense? Totally. Yeah.
I love it. Yeah. Because I think that's scary for people. You ended on a new lens of sexuality, but that's really key too. Yeah. And being open to that and allowing that. Yeah, I think can be hard when you're totally in that phase of life.
Yeah, and there's such an emphasis kind of culturally, you see on the magazines, this bouncing back or getting back to your body pre-baby, or back to your pre-baby job or life or sex life. And one thing I really emphasize with moms is And it's going to sound a little bit like, oh, but there is no going back, right? Like, you are not the same person, and that's not a bad thing. So let's learn about this new person. Let's figure out who she is and how she's going to now live her best life as a mother, as a woman, as a partner, and what might that look like for you. And there is some grief, right? Like, you lose a lot of freedom. You lose a lot of things when you become a mother, and you gain a lot of things too. You know, it's absolutely right and fair and valid to grieve some of the things you've lost, to be sad about the fact that, like, hey, I can't just go meet my girlfriends for happy hour anymore. Right. Or maybe I can't run without wearing 4 sports bras or whatever. Yeah. You know, some of the things that used to feel easy and, you know, free aren't that way anymore. And that's a loss, and it's significant, and it's, a lot of women don't feel like it's safe or acceptable. They feel guilty because they missed their life pre-baby. And we deal with that a lot too. We process through that, and we start to look at, how has your life changed? What have you gained? How do you want this to look moving forward, and how can I support you in that?
That's great.
Yeah.
That's cool. So do people get ongoing support through postpartum? Is it, or like, do you find that people do really well with 12 sessions, or how does that work?
Yeah, great question. So I don't ever really give any sort of prescribed, here's how long I expect for you to feel better. Yeah. Some people will start to feel better after one session, especially if they, you know, don't necessarily have a diagnosis. And I would never just see a client for one session. It doesn't really work that way.
Right.
But some people will leave that first session feeling like, okay, I feel better, because they've had someone hold space for them, because they feel heard and listened to, yes. and someone has made their experience feel normal, yeah. and that's what they needed. Honestly, most of my clients tend to come and stick around for a while. And I love that. I love having ongoing relationships with my clients, partially because motherhood changes so quickly, especially in those early days. I mean, baby is growing like crazy. You don't have the same child from week to week, so you don't have the same mom from week to week. So it's, you know, I always encourage my moms, like, as long as you feel like you need the support or you want the support, I'm here for you. And some, after, you know, 5 or 6 sessions, will say, okay, I think I got through the rough patch and I'm feeling pretty good. And we'll reduce the amount of time we see each other. Maybe it's every other week. Maybe It's once a month. And eventually, as, you know, women are feeling better and feeling like they kind of have a handle on how to do this mom thing, and they're feeling okay again, we might just say, check in when you need me. Cool. So that's kind of how the process works. So I wish I could give you a more clear answer, but right. oftentimes most of my clients I've been seeing for 6 months or more.
Okay.
Yeah.
Cool. That's great. Yeah. I think everyone needs it. Really, truly.
Yeah.
So.
Me too.
Because it's so easy to listen to this podcast and be like, oh, okay, that feels supportive. That's good. Mm-hmm. Whatever. But until you have someone normalize, like you said, your own personal story,
right?
It's like, it doesn't actually mean that much,
right?
You know? So yeah. It's just like, it's like the getting it off your chest
yep.
to someone who's actually listening, not
yes.
just hearing, you know?
Totally.
So I think that's cool.
Yeah, because everyone's experience is, there's so many parallels and so much we have in common as moms, but it is so different for everyone. Everyone has a different situation in terms of how much support they're getting at home and from family. You know, I know some moms will have in-laws who are babysitting every weekend and others who have no family in the state. Everyone's kind of dealing with a different deck of cards. And so while we can definitely connect over some of the common things happening to all moms, every mom does need the opportunity to tell her own story and have it be validated.
Yeah.
You're so right about that. Yeah.
Absolutely. Cool. Anything else you want to share?
Nothing off the top of my head.
Any events coming up?
No particular events.
Okay.
I will be, hopefully, the issue is timing, just making sure I have space and time that align at the same time. But I am looking to begin sometime in the next few months a postpartum support group.
Oh.
And I'm very excited to be able to do that. So the details are still a little bit in the works. But I'm hoping sometime in like the February, March timeframe that will come together, and I'll be happy to report back to you when I have more information on that.
Yes.
But the format is basically going to be, you know, some opportunities for moms to come together and share in a small and intimate group setting. And then also have some opportunities to hear from me, like on a different topic each week. So we might talk about feeding one time. Yeah. We might talk about sleep and how mom can get it, how we can manage it and cope if baby's not getting it.
Right.
And so just kind of dealing with some topics that are really common. Talk about sex. We'll talk about relationships, some of those really common things. It's probably going to be about an 8-week group. So it'll be kind of session-based. So moms can sign up for their 8-week group. And my intention for that is that it'll be a smaller setting. Moms will have a lot more time than they maybe would in a more public setting to tell their stories, to be heard, and to validate each other, but also get a little bit of education and support, and possibly leave the group with an additional sense of community. Yeah.
Fantastic. Oh, I love that idea. You'll let us know. That's huge.
Yes. Excited for it.
And so needed.
Yeah.
There's not much of that in the community at all.
Right.
So I think that's amazing, especially for someone who's maybe a little timid and not ready to do individual counseling and, ready to share their story that way.
Yeah.
It takes the pressure off.
Totally.
Yeah. Cool. And so the other thing is Jessica is accepting new clients right now.
Yes.
So very limited space.
Yes.
But if you are listening to this, jump on her schedule ASAP because she's truly awesome and very, very smart. And I know my clients just love working with you.
Oh, thank you.
We're so excited you're here and thank you for being here.
Thank you for having me. It's been so fun. Do you have my website and all that available?
Drop it here. Go ahead and say it.
So, website URL is just Jessica Psenski, PSENSKI.com. And that has information about what I do, how much I charge, where my office is, and all of that, and a contact link as well if you want to get in touch with me.
Cool. Thank you. And we'll put that in the show notes as well.
Oh, perfect. Okay.
So.
The Edmonds Moms Room podcast is brought to you by Body Motion Physical Therapy. We help women through pregnancy and beyond so they can live active, confident, and healthy lives.